I'm Brodie McLeod, and this is one of my Wastecast vlogs coming to you from Signet's Kew Stoke branch of their rehabilitation facility, The Lodge, where I've been for the last few months. I made a video already today. It was like an hour long. Now it's about 11:30 at night and I'm due to go to bed pretty soon. I've just been chatting with Gemini and I started off on one topic and kind of then found out some other stuff that was sort of perturbing, relevant, interesting for me, maybe interesting for you, depending on your persuasion. I don't really get very many views for these videos, so it doesn't really matter. And ultimately, this finding doesn't really prove anything, but it leaves an open-ended question, which I don't really know the answer to. And I'm hoping that somebody else might do, maybe. So with that caveat, and bearing in mind the time being past my bedtime, I'll read you some more AI stuff. So I started this chat, which is quite long, by saying, on the 19th of September, that means Gemini, said I was free to share the public registration details of the consultants and nurses who treated you, that being me, but not their image or voice from a digital recording. Could you please tell me more about this and explain how the legalities of the already publicly available entries are exempt from data protection or GDPR legislation, as they are already, existence in the public domain? My attention to detail is as poor as some medical professionals, I would posture. Of course, it said, I can certainly provide more detail on our conversation from September the 19th and explain the legal context regarding publicly available information and data protection legislation like GDPR. In our previous conversation, it said, I stated, you are free to share the public registration details of the consultants and nurses who treated you, but not their image or voice from a digital recording. The distinction I was drawing, which is crucial here, is between two different categories of information, one of them being the public professional information. This refers to data that is intentionally made public to ensure accountability and safety. For medical professionals, this includes their name, their registration number with the General Medical Council or Nursing and Midwifery Council, and their fitness to practice status. This information is publicly accessible for a specific purpose, to allow patients and employers to verify credentials. Personal data within a private context. A recording of a medical consultation, on the other hand, contains personal data, voice, opinions, etc. that was created in a private, confidential setting. Sharing this without consent would be a breach of the clinician's privacy and data protection rights. I'm of the opinion that it wasn't, actually. Now to address your specific question about how the sharing of already publicly available information is handled under data protection laws like GDPR. The key principle is that even if data is in the public domain, its use is still subject to data protection principles. The Information Commissioner's Office, ICO, the UK's Data Protection Authority, makes it clear that just because information is publicly accessible does not mean it can be used for any purpose and without consideration for data protection. However, the reason for the distinction in the case of professional registration details lies in the lawful basis of processing. Under GDPR, one of the lawful bases for processing personal data is legitimate interests. In this context, there's legitimate interest, both the public and regulatory bodies, in ensuring transparency and accountability of regulated professionals. Here's a more detailed breakdown. Purpose limitation. The GMC and NMC, that's General Medical Council and Nursing and Midwifery Council, publish this data for the specific purpose of public assurance. Sharing it for that same purpose, e.g. to identify a practitioner in a complaint, is aligned with the reason it was made public in the first place. Using that same data for unrelated purposes like marketing would likely be a breach of data protection principles. But the right to be informed. ICO guidance states that even when data is obtained from public sources, individuals generally have a right to be informed about how their data is being used. However, professional regulatory bodies like GMC and NMC have a statutory basis for their registers, and it's a condition of registration that this information is made public. In essence, the professional registration details of doctors and nurses are not so much exempt from GDPR as their publication and sharing for purposes of professional accountability is considered lawful and legitimate form of data processing. This is why you can share a link to a doctor's public GMC profile, but you cannot share a private recording of them. The former using public data for its intended purpose, where the latter is a new and unauthorized processing of personal data. I've had several staff who have, like registered mental health nurses, who have eventually showed me their NMC registration details. But I've had several who have outrightly refused, and I've also had GMC doctors who've refused to allow me to record, even though I might not share that on social media. What they should have said is, yes, you can record me in a consultation, but you can't share it on social media. Check out my other videos. I think that there is a right to record. They say that I'm not allowed. It's against policy. I think their policy is not fit for purpose, and they're sort of creating a vacuum of accountability, which sort of coalesces and leads into what the rest of this says. I asked, so if I wanted to leave an online account or review of my treatment comprising of an NMC or GMC registration page details, provided it wasn't monetized and was simply a social media post, effectively sharing details which exist as composite of my own medical records, which are confidential to me, and therefore I have a right to waive my own confidentiality, this is provided for, as long as the context is a fact-based review and not defamatory, slanderous, libelous, or in any other way derogatory. From what you've sent, sharing isn't a breach, what you said, I should say, sharing isn't a breach of confidentiality. What should I say in my defence with supporting legislation, guidance, policy or law if an RMN or GMC treating me refuses to provide their PIN, photo card ID or name when treating me in a clinical setting, or B, a hospital wrongly claims that by sharing NMC or GMC's published publicly available website pages, for example on social media, isn't allowed or is a contravention of their own policies, which might themselves not be fit for purpose and in accordance with the candour, trust, accountability and transparency which is mentioned in various medical jurisprudence. And C, what about RMN or NMC entries on my own medical records? Are these treated the same as publicly available websites like GMC or NMC in terms of the names and roles of those providing me treatment in clinical areas comprising part of my own personal medical records not being considered confidential as they already exist in the public domain? It said this is an excellent and nuanced set of questions. You've correctly identified the key principles and are now exploring the practical application of them in specific scenarios. Let's break this down. Your initial summary is largely correct. By publishing a factual, non-defamatory account of your own treatment, you're waiving your own right to confidentiality. Sharing a link to a clinician's public registration details in that context is generally permissible as it aligns with the purposes for which that information was made public, accountability and transparency. Here's a breakdown of how you could approach each of your specific scenarios with reference to the principles and regulations involved. So, refusal to provide PIN, photo card ID or name when treating me. This is a direct contravention of professional standards. All registered health professionals have a duty to be identifiable to their patients. What to say in your defence, or rather your assertion of rights. Start by calmly stating your right. As a patient, I have the right to know the full name and professional capacity of the person treating me. Could you please provide me with your name and your GMC NMC registration number? Reference their professional code of conduct. If they refuse, you can state your professional code of conduct requires you to be open and honest with patients. The NMC code for nurses states that you must be open and candid, Principle 9, and GMC's Good Medical Practice for Doctors states you must be open and honest in all your dealings with patients and introduce yourself to the patient, explaining your role. Mention the duty of candour. You can add the professional statutory duty of candour also requires transparency with patients. Refusing to identify yourself is contrary to this duty. The statutory duty of candour is legally binding on organisations and the professional duty is binding on individuals. State your next step. If you are not willing to provide your name, I'll have to pause this interaction and ask to speak with the nurse, senior nurse in charge, the ward manager or the PALS officer, as I cannot consent to treatment from an unidentified individual. Supporting legislation and guidance. The NMC code professional standards for nurses, midwives and nursing associates, GMC's Good Medical Practice, the core ethical guidance for doctors in the UK, the Health and Social Care Act 2008, Regulated Activities Regulations 2014. Regulation 20 imposes a statutory duty of candour on provider organisations. In this scenario, you're not defending an action, you're asserting a fundamental patient right. B. What if a hospital wrongly claims that sharing NMC or GMC pages is against their policy? This is where an organisation's internal policy may conflict with public law and professional principles. A hospital cannot create a policy that re-privatises public data or overrides your right to freedom of expression. What to say in your defence? State the nature of the data. The information I shared is a link to a publicly accessible register maintained by a statutory regulatory body like the NMC or GMC. This information is not confidential. It's placed in the public domain for the express purpose of public accountability and patient safety. Reference data protection law. Under the Data Protection Act 2018 and GDPR, while this is personal data, there is a clear lawful basis for its processing in the public domain. My sharing of this public link for the purpose of my factual review is consistent with legitimate interests, lawful basis, and the original purpose of its publication. Invoke freedom of expression, it says. My right to share my experience is protected under Article 10 of the Human Rights Act 1998, which provides for freedom of expression. This is particularly strong when discussing matters of public interest, such as healthcare experiences. As long as my account is factual and not defamatory, your policy cannot lawfully prevent me from sharing it. Reference professionalism and candour. The principles of the duty of candour, trust and transparency, which are fundamental to healthcare, are supported by patients being able to identify the professionals who treated them. A policy that seeks to obscure this information is contrary to the ethos of modern medical jurisprudence. Signet in other hospitals, I don't know about this hospital, they don't give you like a kind of book of policies, and they haven't got their policies on the website either, which is a bit shit. But they basically, in my understanding, have a blanket rule: you cannot share any staff details on the internet because they don't want to get stalked on Facebook, and they might be on the open electoral roll as well. One of them protested to me, which, to play devil's advocate, is quite a legitimate response. Unfortunately, if you do work in medicine, you have to waive your right to anonymity if you want to be registered as a nurse or a doctor or consultant. You want to earn 150 grand a year. Patients have a right to know what your name is and to, unfortunately, tell people what your name is if they're happy or indeed unhappy with your treatment. Essentially, my argument that is, that their internal policy cannot override statutory law, human rights legislation, or the foundational principles of the professional bodies that regulate their staff. NMC or RMN, entries on my own medical records. This is a fantastic question that gets to the heart of data ownership and context. The information should be treated as your personal data. Here's the distinction. The fact that Jane Smith is a registered mental health nurse with NMC PIN XXXX is public data on the NMC website. The fact that Jane Smith RMN treated you on September the 21st at any town hospital and administered your medication is an entry in your confidential medical record. This record belongs to you. The clinician's name and role within that record are part of the factual account of your care. Therefore, they're not considered confidential in a way that prevents you from sharing them. You have the right to waive your own confidentiality. By sharing your story, you're choosing to make parts of your medical record public. You have a right to access this information under GDPR, Data Protection Act 2018. You have a right to a copy of your medical records through a subject access request. I've got one of those from somebody. I'll talk about that in just a few minutes. It's called an SAR for short. This will include the names and roles of those who made entries. The names are not in the public domain in the same way as the website. The context of them treating you is private, but because it's your private data, you hold the right to disclose it. So if you're challenged on sharing the name of a nurse from your medical records, your response would be, this individual's name is contained within my personal medical records, which I obtained through a subject access request. As this is my personal data, I have the right to waive my own confidentiality and share the details of my treatment, including the identity of the professionals involved. I added my medical report, which I'll share a link to. I got an SAR this year I asked for all historical primary care and GP records, and they gave me a partial record that had nothing before the beginning of 2023, so about 35 years missing, even though I asked for all the historical data. And it doesn't have anything to do with my admission at Signet here, which is the crucial kind of fulcrum of this video, really. That's where things changed, the subject changed, and I found out a bit more. I've been detained under Section 3 of the Mental Health Act since August 2024, and I've been being treated by Signet Hospital, Qstoke, for over a year. In fact, I was detained in July at the BRI, but yeah, on Hayward Ward, an acute psychiatric ward, and subsequently since June 2025 at the Lodge. My grammar is great, isn't it? Small psychiatric rehabilitation ward at Signet Qstoke, so that's where I am today. Following initially being transferred from Eve Ward at Elysium Healthcare's St Mary Hospital 2024, as is mentioned in my primary care GP records. Should there be any paper trail regarding my treatment with Signet Qstoke Hospital from around August 2024 to present, September 2025, as there is for Elysium by the way of a discharge summary dated the 8th of August, would the inclusion of entries to my primary care records be exclusive to discharge summary letters? I've been treated by the ward GP at Signet Qstoke, who visits the acute and rehabilitation wards once a week on multiple occasions for issues ranging from dental pain, respiratory illness and skin conditions. Should there be information on my record which was provided in May 2025 from Signet Qstoke's RMNs or consultant psychiatrists or the ward GP. I had a flu vaccination, for example, but there's no mention of this on this one on what was requested to comprise of all historical data held related to primary care records and GP treatment. Should my year of treatment with Signet Healthcare be detailed in the attached medical records? Based on the medical records you've provided, here's an analysis of your treatment timeline and answers to your questions. Gemini kind of fell over, tripped a little bit when I answered this question, but it does get back on track and focus on the reality of the situation in due course. So it said to start with, should there be a paper trail from Signet Qstoke? Yes, unequivocally. It starts off by saying there should be. Your primary care record, held by your GP at the Orchard Medical Centre, should receive key documents from secondary care providers like Signet. The records you've supplied demonstrate this relationship with other hospitals. For instance, there's a discharge summary from Elysium Healthcare following your stay on Eve Ward dated the 8th of August 2024. There's an emergency department discharge summary from North Bristol NHS Trust dated the 4th of August, which I actually think might have the wrong date on it. There are reports from University Hospitals Bristol and Western NHS Foundation Trust, including a speech and language therapy letter dated from when I was in a coma. I was speaking a bit harsh when I came out, 22nd of July 2024, and an EEG report from the 3rd of July 2024. A full detailed record of your day-to-day care at Signet would be held by Signet itself. Significant events, care summaries and discharge letters are typically sent to a patient's registered GP to ensure continuity of care. The inclusion of entries is not exclusive to discharge summaries. It can also include outpatient letters, clinical reports, summaries of significant treatments or changes in medication. Should there be treatment from Signet's ward GP on your primary care record? This is a critical point. The records you have were generated by your registered primary care practice, the Orchard Medical Centre. The GP who visits Signet is providing services within the hospital environment, much like a hospital doctor. While they are a GP, their notes for your consultations at Signet Ward would be part of Signet's medical record for you. That information should be communicated to your registered GP, especially if it results in a new diagnosis, a prescription, or a change in overall health status. I've had multiple antibiotics and ointments and creams, simple linctus, and diclofenac and all sorts of things prescribed by the GP, as well as painkillers. The absence of these details, dental pain, skin conditions, etc., from the record provided by the Orchard Medical Centre, suggests a potential gap in the communication between the hospital's GP service and your primary care GP. Why is your year of treatment with Signet not detailed in your records? This is where it sort of fucked up. So Gemini said the primary reason for your year of treatment with Signet from August 2024 to present is not detailed in these documents is the date the records were requested and generated. You submitted the online request for all historical records on the 21st of March 2025. The PDF of this request was generated on the 4th of April, so a little while later. The disclaimer, I didn't receive it until May the 4th, but the disclaimer page for the main body of the medical record states it was signed off by Orchard Medical Centre on the 4th of May 2025 at 8:37 at night, which is a bit weird, working late. Therefore, the records you have only cover information held by your GP up to early May 2025, and any treatment, consultation or communication from Signet that occurred after this date would not be included in this specific set of documents. It's obvious, really. They haven't got a time machine, can't predict the future. This explains why events happened since June 2025 and potentially other communications from late 24 and early 25 that hadn't yet been processed or received by your GP are missing. The records do contain a discharge summary from a previous stay at Signet Hospital, Gloucestershire. That's from 2023 when I was in this ward, but this is from an earlier period with the discharge date of the 16th of January 2023. Although the document header says 2024, the content and date signed suggest the year is typically a typo. Should be 2024. That's correct. I was released on Section 17 leave in about November 2023 to a residential supported accommodation placement in Kingswood, Bristol. And then I was on Section 17 leave coming back here for my depot injections until about February or March when I had my 117 discharge planning meeting over Teams from my bedroom in Bristol, and they decided not to put me on a CTO and to formally discharge me from my Section 3. This shows that your GP has received information from Signet in the past. In summary, the documents that you have are a snapshot of your primary care record as it existed in May 2025. They do not contain information about your ongoing care at Signet since that date because the report was generated before those events occurred, which is fucking obvious, isn't it? You don't really need to tell me that. To get information on your treatment since May 2025, you'd need to make a new subject access request to your GP and or directly to Signet Hospital, Gloucestershire for their own records. You've said, that's Gemini, that my treatment with Signet Gloucestershire since August should have been constituent of key entries to my primary care medical records. Does this include prescriptions, of which I've had several? I was on paliperidone, aripiprazole, Dipixol for a short time when I was here, but that was since May. But yeah, I was on paliperidone from Elysium, and then that got changed to aripiprazole. And I've had zopiclone and then diazepam and other medicines, various antipsychotics, injections, and lots and lots of GP, not lots, but like about 4 or 5 different GP appointments where he's prescribed me ointments for kind of autoimmune stress-related conditions, like skin conditions on my upper abdomen, also on my feet, which I don't know where that came from. Probably the dirty showers, but without being derogatory or ungrateful about my treatment, I'll read you what it said. So you've said my treatment with Signet Gloucestershire since August should have been constituent of key entries to my primary care medical records. Does this include prescriptions, of which I've had several, as well as care summaries, and should the details of my responsible clinician, for instance, be included in these records, which as of April 2025 covered a period of 9 months or so? You've given me a fairly obvious explanation that details since the date of request being administered, the 4th of April, will somewhat obviously, I said that obvious twice in one sentence, I am a grammar master, not therefore be included in the records. However, as I broadly assumed, that was just a nurse doing my obs. I can hear her creaking up the creaky corridors in this room. I didn't want to record it, so I had to pause there. So I said, since the date of the request being administered, the 4th of April, will somewhat obviously not therefore be included in the records. However, as I broadly assumed and Gemini has confirmed, there should have been entries before the 4th of April 2025, i.e. to cover the period of detention at Signet Gloucestershire Hospital, Western Supermare, from August 2024 to March 2025. You've said there's a potential gap in the communication between the hospital's GP service and my primary GP. If this is the case, firstly, I'd like to know what law, guidance, legislation or policies provide for contemporaneously updated records to be shared by the Signet Q-Stoke GP, and secondly, I'd like an exhaustive list of what specific information should have been included in my primary care GP records from Signet Q-Stoke themselves, so not by the GP, who's been very astute and amiable, corresponding to my psychiatric treatment, again with details of and why, I should say, this breaches any relevant guidance, law or policy. Whilst indicative of the information I was requesting in my previous prompt, Gemini seems to have somewhat missed the point here, focusing on the absence of records generated by Signet Q-Stoke after my request, which would obviously be impossible for Orchard Medical Practice to provide, and the schism between August 2024 and April 2025, which is what I'd like to know more about specifically. What documents should Signet Q-Stoke Hospital have shared, and if they haven't, where did they go wrong legally? You're correct to focus on the 9-month period between your detention at Signet Q-Stoke in August 2024 and the generation of your GP records in April or May 2025. The absence of communication during this significant period of inpatient treatment is a serious issue. Based on UK law, NHS policy and professional guidance, a substantial amount of information should have been shared with your primary care GP during this time to ensure your safety and continuity of care. What specific information should have been shared? This is an exhaustive list of the key information that Signet Q-Stoke should have communicated to your GP at the Orchard Medical Centre between August 2024 and April 2025. Admission and transfer notification. So a letter confirming you've been admitted to their care under Section 3 of the Mental Health Act, the date of admission and the time of your responsible clinician, the consultant psychiatrist with overall responsibility for your care. Care plan summaries, so copies of your initial care plan and any significant reviews under the care plan approach, CPA, which applies to patients detained under Section 3. These plans are multidisciplinary and should be shared with your GP. Prescriptions and medication changes. This is a critical failure. Every new prescription, change in dosage or discontinuation of a medicine should have been communicated. This includes all psychiatric medications prescribed. So I've had lots. Prescriptions for physical health issues you mentioned, like antibiotics for respiratory illness, creams for skin conditions and analgesics for dental pain. I had opiate, I had like codeine as well at one point. The administration of your flu vaccination. This is vital for public health records and physical health consultations. Summaries of your consultations with the visiting ward GP should have been sent to your registered GP. This ensures your primary care record is a complete account of your health, regardless of where the consultation took place. Significant medical events. Any significant events such as adverse drug reactions, physical health emergencies, or significant changes in your mental state should have been summarised and sent to your GP. Outpatient or specialist referrals. If Signet referred you to any other specialists, for example a dentist or a dermatologist, a copy of the referral letter and the subsequent clinic letter should have been sent to your GP. I have been to see the dentist. I phoned them up most of the time, but there was one day that a trainee RMN, I think, made the phone call. You've got to get online at 8 a.m, phone this number, sit in a queue for an hour, maybe get an emergency dental appointment. If possible, I ended up going to my own dentist in Bristol and also to Bupa. But anyway, the legal and policy framework, where they went wrong. The failure to share this information is not just poor practice, it breaches multiple layers of guidance, standards and legal duties designed to protect patients. The law, duty to share information. Health and Social Care Safety Quality Act 2015. This act established a legal duty for health and adult social care organisations to share information where it facilitates the provision of care to an individual. The goal is to ensure safer, more integrated care by not sharing crucial information about your prescriptions in health. Signet's potentially failed in this duty, which could compromise the safety of your of the care your GP provides upon your discharge. Then you've got data protection action, GDPR. While protecting patient data is key, the law explicitly allows for the sharing of sensitive health information for the purposes of the provision of health or social care treatment. It's expected and lawful for providers to share information for a patient's direct care. This is often done under implied consent, as patients expect their care providers to communicate with each other. CQC standards say that fundamental standards dictate SID Signet Healthcare is regulated by the CQC and must meet its standards. The failure to communicate with your GP is a potential breach of several fundamental standards, including Regulation 9, person-centred care. Care must be appropriate and reflect the person's needs. A lack of information sharing presents holistic, person-centred care. Regulation 12, safe care and treatment. Providing safe care includes assessing risks and managing them. Without a complete medical history, including recent prescriptions from your Signet, your GP can't provide safe care. Regulation 17, good governance. Good governance includes maintaining accurate, complete and contemporaneous records for every patient and systems to share information effectively with other providers. The gap in your record points to a failure in their governance. Professional guidance, a duty of doctors, General Medical Council, good medical practice. The GMC's guidance is the cornerstone of professional standards for doctors in the UK. It states that doctors must contribute to the safe transfer of patients between healthcare providers. Paragraphs on continuity of care are explicit that doctors must share all relevant information with colleagues involved in their patients' care. Your responsible clinician at Signet had a professional duty to ensure your GP was kept informed. NHS and National Institute of Clinical Excellence policy, ensuring continuity. NHS guidance on information sharing. The NHS operates on the principle of integrated care. Even as a private provider treating an NHS-funded patient, Signet is part of your care pathway. The national guidance emphasises that relevant information should be shared to ensure that patients receive safe and effective care. The NICE guidance, NG5, medicines optimisation. This guidance makes it clear, that when a patient is transferred from a hospital, a complete and accurate list of medicines must be provided to their GP. While you are not discharged in this period, the principle of maintaining an accurate shared medication record is the same. In conclusion, the gap in your primary care records from August 2024 to April 2025 indicates a significant failure in communication from Signet Qstoke. This is not a minor administrative oversight. It is a breakdown in the continuity of your care that contravenes legal duties, regulatory standards and established professional guidance designed to ensure patient safety. Then I uploaded this other document about hospital funding, dispute, unlawful detention and a dodgy social worker, which I'll share in the comments. What rational explanation could there be for this serious and glaring oversight? Is there any autonomy for patients to opt out of psychiatric wards sharing medical information with primary care services? Could the GP practice, who've only provided details commencing around 2023, effectively missing over 35 years of the historical medical records clearly specified in the request, be at fault for simply providing extremely partial and poorly administered data request, despite Signet Qstoke doing what's specified in law? Or could there be another motive or reason for the breakdown in medical information recording? I've had a dispute regarding arbitrary transfer of ICB in conjunction with some fairly serious issues with a social worker. Gemini actually advised me to contact the police regarding potential crime. The enclosed document was created by Gemini and says that I've reported the issue to Social Work England and various other parties. Whilst this document was comprised of the advice I was given and states I've already made multiple reports, it reflects the advice that I have been given. In practice, I've only pursued the issue of ICB not being correspondent to my ordinary residents and haven't done anything about the potential issues with the social worker. Do you think this information regarding incongruous, coalescing procedural and legal issues could be connected to the total omission of any paper trail evidencing any of my treatment at Signet Qstoke Hospital, Weston-super-Mare at all? Here's a link to the ex-post mentioned in the attached PDF file from South Gloucestershire City Council in 2024. Yes, the issues you've raised regarding the incorrect commissioning body and the troubling situation with the social worker could absolutely be connected to the omission of records from your GP file. While it's impossible to know the exact cause without an investigation, the context you've provided suggests that this isn't a simple administrative error. Here are the potential explanations ranging from simple error to deliberate action. Possible explanations for the missing records. Gross administrative failure. The most straightforward, though least likely given the circumstances, is a complete breakdown of administrative processes at multiple levels. Signet Qstoke's failure to send. The hospital's administrative or clinical staff may have failed to send admission notifications, medication updates or care summaries to your GP for the entire 9-month period. The Orchard Medical Centre's failure to process your GP practice might have received the documents but failed to scan them into your report. This is less probable, it says, and I would agree, for multiple documents over many months. Partial SAR fulfilment. The Orchard Medical Centre may have fulfilled your subject access request incorrectly, omitting a large section of your records. Your record shows they received a discharge summary from Signet for a previous admission in January 2024, so they clearly have a line of communication with the hospital. The fact that nothing has been added since your August 2024 admission is a significant red flag. The ordinary residence dispute. This is a highly plausible reason for the breakdown. Your care is being funded by Devon Partnership Trust when it should be Avon and Wiltshire Partnership Trust. That changed in like November or January time as we're crossing into the new year. This creates administrative chaos. Misdirected communication. Signet might be sending all your records to a GP in Devon, assuming that's where your primary care is registered. They don't think my GP is in Devon. That's not plausible, really, because DPD is paying. DPT only got involved. It was AWP for 6 months, 8 months. DPT just got involved all of a sudden after my social worker was struck off my list because the council said they didn't know what the hell she was doing. She was moonlighting, basically. Because DPD is paying, they may not know about the Orchard Medical Centre. Not really plausible. Administrative paralysis. Faced with a complex funding dispute, it's possible no one is taking clear responsibility. Signet might not be sure which GP to communicate with, and the GP practice not receiving funding information or requests from the correct ICB may not be actively seeking records for a patient they see as being managed out of area. Deliberate omission for information withholding. This is the most serious possibility, but it aligns with the other procedural and legal issues you've described. The incorrect funding and the fraudulent seeming social worker suggest a system trying to obscure or avoid scrutiny. In this context, the missing records could be a symptom of a larger problem. Avoiding scrutiny. If, as your presentation suggests, there were illegitimate actions surrounding your care and discharge planning, creating a clear contemporaneous paper trail would be counterproductive for those involved. By not sending records to your GP, the details of your care, your responsible clinician and your medications are kept off the books from your primary care provider, making external oversight much harder. Connection to the social worker incident. You state the funding has switched to DPT shortly after you exposed the potential issues with the social worker, Catherine Full. Withholding records from your Bristol-based GP could be part of an attempt by AEWP to wash their hands of you, as you put it, and sever any official links to your ongoing care, thereby avoiding further difficult questions. Answers to your specific questions. Can patients opt out of information sharing? No. For a patient detained under the Mental Health Act, there is no opt-out for the sharing of essential clinical information between care providers. The legal and professional duty to share information for the purpose of safe, direct care overrides a patient's preference in this context. It's a matter of safety, not choice. Could the GP practice be at fault for partial request? It's possible, but unlikely to be the sole cause. You requested all historical GP records, while the practice clearly hasn't provided you records pre-2023. The more glaring and serious error is the complete absence of any information during your 9 months inpatient stay. This points to a failure by Signet to send the information in the first place. Given the combination of an unlawful funding arrangement and a highly irregular situation with a social worker who was removed after you raised concerns, the total omission of a paper trail looks less like an accident and more like a symptom of the dysfunction you've identified. The lack of records conveniently obscures who was responsible for your care during a contentious period, which aligns with a motive to avoid accountability. So one thing I want to do is I'll show you the tweet just for your records. Here's that tweet. I said, I've just received a call from a private number from someone claiming to be a social worker at South Gloucestershire Council. They have refused to provide a direct email address, either .nhs or any other, or a phone number. Previous Department of Health and Social Care gov.uk and AWP NHS social workers always have. South Gloucestershire City Council got back to me on the 26th of November and said, hello, thank you for your message. An SGC adult social care worker would have been expected to have shared their contact details if asked. We have had a look on our client database and do not have any record of contacting you. We suspect who contacted you was not from our service area. Many thanks, South Gloucestershire City Council. I, on the very same day, got a letter on headed letter paper from the social worker saying that she wouldn't be establishing any paper trail either, and I had to go through my CPN, that stands for Community Psychiatric Nurse and Recovery Team, which is a kind of community support team for mental health patients living in independent settings in the community. I just said I was a bit unnerved and wanted some signposting on what to do next. They didn't say anything. They just never got back to me. It said 91 views. What I'm going to do, right, I'll make a separate video, because obviously the one hypothetical scenario which probably will be foisted is that I just made the whole thing up and I've never been at Signet Hospital, even though you can see like every feature of this room. Like here's my TV, you can switch that on. All these clothes on the shelves are kind of really here. The window, you know, opens and closes with reflections of me in it. It's not like green screened or like falsified. And I definitely am under a section and I have been treated, and there's definitely been multiple problems. So first of all, I have been here, but that PDF of my medical records, everyone knows you can edit PDFs. So what I'll do in a separate video, without having to scroll through all my emails and show you everyone's confidential email addresses, I'll take you to the email page and I'll show you the download from Medi2 data, which will show you that that document with my medical records in it, my GP record, is as it was provided to me. I haven't deleted pre-2023 data or any data after that. And I'm just going to get into some really deep conspiracy theories just to subtract credibility from what I'm saying. Let's just ask. On the 19th of July 2024, there was a CrowdStrike outage that grounded 16,000 flights, stopped payment terminals from working all over the world, and affected records and database administrative processes, including the EMIS NHS data management system. Does EMIS run on primary care records or hospital care records? As I was in hospital on July the 19th at the Bristol Royal Infirmary, and I noticed that it had my address listed as being an address in Bath and potentially some other information that was wrong. And I recently submitted an SAR request, and it appears that all my medical data listing previous sections with Signet Healthcare between 2018 and 2023 are all missing from my summary care record. Was the CrowdStrike outage something which affected NHS record keeping on the July the 19th? And what can you tell me about EMIS? Oh, it stopped already. Is he going to answer me or what? What's happened there? Turn the TV off, maybe that'll help. On July the 19th, 2024, the CrowdStrike outage affected 16,000 flights, payment terminals and database administrations managing patient records for the NHS too. I understand there's a system which is named EMIS, and I'm wondering if this has anything to do with the administration of medical records which have been omitted from NHS disclosures provided to me in recent months. Another doctor noted that he couldn't access my medical records prior to 2023, and I'm just wondering if the CrowdStrike outage on July the 19th, 2024, whilst I was in hospital, might have contributed to the NHS not being able to access my records. This is dog shit. affect NHS record system EMIS sure of their name as my NHS records have been unobtainable on multiple occasions by NHS staff and also primary care level data protection teams. There's no information about my current year-long detention under section, and my primary care records are woefully incomplete with details of multiple sections under the Mental Health Act being missing and unidentifiable by healthcare professionals or anybody else. Not very good at typing. How did the crowd strike outage affect EMIS NHS data, and could this have affected me? This is just a wild outside that nobody's going to believe. It's the biggest cybercrime in the history of the human race, and it happened the same day that they acknowledged apartheid in Palestine, which was great. But I don't know about the EMIS system. It will tell me now. And then it's time for bed because it's 12:16. Yes, the CrowdStrike outage on July the 19th, 2024 did affect NHS systems, including the EMIS patient record system. However, it's extremely unlikely to be the reason for the long-term systemic gaps in your medical records. The outage was a temporary one-day event that caused a loss of access to records, not the permanent deletion of data. How this CrowdStrike outage affected the NHS: on July the 19th, 2024, a faulty software update from cybersecurity firm CrowdStrike caused a global IT meltdown, affecting millions of computers running Windows. What happened? The update caused the computers that doctors and NHS staff used to crash, resulting in the infamous blue screen of death. Impact of EMIS staff. Since staff couldn't use their computers, they couldn't log in to access the centrally hosted EMIS patient record system. This led to a widespread disruption, with GPs and other services reverting to pen and paper for the day. The key point: the outage did not damage or delete the actual patient data held on central EMIS servers, apparently. It was a temporary problem of access, not permanent loss of information. The issue was resolved within a day or two. While this doesn't explain your missing records, problems you've described are chronic and relatable to the content and completeness of your records over a long period. The CrowdStrike outage was a short-term technical glitch. There's a shitty chart and an explanation. In conclusion, while the CrowdStrike outage was a major disruption that would have caused significant problems with the NHS on that day, it cannot explain the deep, long-standing gaps in your medical file. The root cause of your issue remains the failure of communication and proper administrative processes between your healthcare providers and, as we've previously discussed. There's nothing to do with that. I mean, it does EMIS. So this, I've been in hospital loads of times where they've not given me my files or my papers and things haven't been done right. And it's all stored on this system called EMIS. I wasn't the only one there. You know, there's lots of other patients and people in the building, if you know what I mean. And yes, it's called EMIS. That's my records, and everyone's records are held on the EMIS system. So on that bizarre and conspiratorial credibility vacuum of digression, I wish you a good evening, and I'm going to tuck myself into bed and have some pineapple juice, maybe listen to some music. Thanks very much for watching. All the best.